Okay, this is case study for the humerus. Today's date is 7/22/2020. Exam to be presented is a 2-view of the humerus, is X-ray modality. The date of the exam was 7/21/2020. The reason for the request was pain. Projections, there was the AP and the PA lateral. Patient was 55-year-old female, ambulatory. Physician's findings were fracture at the mid portion of the humerus. Let's see, 16x16 digital detector with the upright bucky, which has built-in grid. Technique was AEC 75 at 2 mass for both projections. The SID is 40 inches. So this first image, this is the AP humerus. It shows good bony detail to include trabecular markings here. Soft tissue of the skin is seen. There are artifacts. This is the patient's bra. She couldn't take it off. She was in extreme pain. These little snap dills right here. One right here. That's the gown. They have metal snaps. So the patient was upright. For this one, her back was against the upright bucky. She was able to pull her arm and wrist to move it away from the side of her body as much as she could. She has limited movement in the arm. So her body was slightly, she's standing, it was slightly angled out like that. Because we didn't move the CR and because it was done with the upright bucky. So we didn't put an angle on that. We just moved her body. Sorry, I lost my spot. This CR was perpendicular to the mid portion of the humerus. Collimation was to the area of interest, collimated from side to side and from top to bottom. This was a more challenging projection to get because the patient was in extreme pain and was afraid to move her arm. The arm should have been abducted a little further away from the body, but it's still diagnostic to demonstrate the humeral fracture. The anatomy shown includes the acromion, the greater tubercle, slightly in profile, the body of the humerus, the lateral medial epicondyle is down here, and the proximal radius and ulna, a little bit right there. Just you show that so you know that you got the entire humerus. You never want to clip that. You gotta get a little bit, and you gotta get the shoulder girdle, the acromion. There's the soft tissue. Make sure there's nothing in there. The swelling, it shows swelling and all that. Collimation from side to side was good. It's closely collimated to reduce the thyroidal dose to the thyroid and the dose to the breast tissue. And the shield was placed around her waist. Okay, this is the PA. All right. The brightness shows good penetration of the humerus. it's a little brighter in here. It's not that bright, it just looks really bright. The distal portion of the humerus and elbow joint and the proximal radius and ulna, right here. The proximal humerus and shoulder girdle have a decrease in detail because the patient was unable to move her arm far enough away from the body to clear the soft tissue of the body. So it's a little, all this right here, this is all the soft tissue, so we would have wanted to move her out farther to get better detail right there, but she was unable to move. It's still diagnostic quality though, it was still okay. The patient's bra again is seen, and the metal clasp snaps from the gown are here. They should have been moved out of the humerus. That I think should have been moved, but it was still passed. The patient was upright and placed her humerus against the upright bucky. She had her arm placed across her stomach. That's how she was holding it pretty much the whole time. The arm was left in place for the PA medial lateral. She slightly leaned into the board to get the humerus as close to the IR as possible to reduce magnification. The CR was perpendicular, centered to the mid portion of the humerus, collimated from side to side and from top to bottom. The image best demonstrates the head, body, and distal humerus in a medial lateral projection orientation. The acromion process is shown. The lesser tubercle is seen in profile. The humeral epicondyles are superimposed right there. Olecranon in profile. The collimation is good from side to side to reduce the thyroid and breast tissue exposure. Lead apron was placed around her waist. The AP where I've marked the acromion, the greater tubercle in profile. This is the head of the humerus, the proximal humerus, scapulohumeral joint, also known as glenoid, and the acromion process. It's the lesser tubercle. It's a little hard to see through the skin, but it's still there. This capitulum down here, it's superimposed, showing that's a good lateral, and the olecranon in profile.